and welcome to our presentation on creating a culture of openness, why workplace mental health resources matter in tech. We're excited to share our findings from our research on mental health in the tech industry and why workplace supports make such a difference. Our project explored how access to resources, supportive communication, and medical coverage impact whether employees feel comfortable discussing mental health at work. Mental health is one of the biggest hidden issues in the workplace, affecting nearly 1 in 5 US adults. In tech, long hours, constant change, and high performance pressure make things even harder. When employees don't feel safe speaking up, small issues can become crises. Let's take Jordan, for example, a senior developer at a mid-sized software firm. Jordan started feeling constant anxiety after a major product launch. He wanted to talk to someone, but the company never mentioned mental health, and he worried it might hurt his reputation. Months later, after burnout forced him onto a medical leave, the company had to grapple with launching products without him, and Jordan had to grapple with that constant anxiety. So, our research team wanted to know what workplace supports help employees feel more comfortable talking about mental health. This simple question guided our entire study, and we looked specifically at 3 supports companies can control. First, whether employers offer mental health resources, things like employee assistance programs, mindfulness trainings, workshops on stress management, and the like. Second, whether employers openly talk about mental health at work, things like open door policies, feelings check-ins, and language that normalizes mental health. And finally, whether employees have medical coverage that includes benefits for therapy and counseling. We used real survey data from more than 1,000 technology professionals around the world. And in this data set were 11 different variables, and key among those for this study were whether workplaces had resources for mental health, whether employers held discussions for employees regarding mental health, whether employers provided medical coverage with mental health benefits, and finally, respondents' age and gender. We focused on how comfortable people said they'd feel sharing their mental health status at work, from 0, not at all comfortable, to 10, completely comfortable. And then we compared that to the supports that they said were available in their workplaces.
Our results were clear. Employees whose companies talked openly about mental health and offered coverage felt much more comfortable discussing it. Just having resources wasn't enough. Real conversations and culture made the biggest difference. Think of 2 similar tech companies. At Company A, mental health isn't discussed. Benefits exist on paper, but no one uses them. When someone struggles, they stay silent. Their team averages about 6 out of 10 in comfort. At Company B, leaders talk about mental health and remind staff that therapy is covered. Managers even shared their own coping routines. That team's comfort rises to 7 out of 10. And that small jump is statistically significant. Same industry, same pressures, but one conversation changed the outcome. Here's how we got those results. We used the open sourcing mental health OSMI survey over 1,200 tech workers, with about 880 complete records after cleaning. First, we explored the data, who responded, their age, and how comfortable they felt. We also created a new variable called combined support, meaning someone had at least 2 types of workplace support. Then we ran t-tests that checked if comfort levels differed between people with and without supports, and they did. Next, we built predictive models, including attuned logistic regressions, which achieved an AOC of 0.66, meaning it predicted comfort levels much better than chance. Both the statistics and machine learning results pointed to the same message. Coverage and communication really matter. So, how much do these supports matter? People without support averaged about 6 out of 10 in comfort, while those with supports jump to nearly 7 out of 10. A meaningful difference when you're talking about someone's sense of safety. The bar chart on the left shows that when employees don't talk about mental health, comfort is split almost evenly. But when they do talk openly, high comfort response rise sharply, and low comforts one drop below 9%. So in short, when leadership or HR starts the conversation, comfort and openness go up across the board. It's not about fancy programs, it's about normalizing the conversation.
Why support works. Each type of support plays a unique role in building psychological safety. Coverage that includes mental health benefits removes financial barriers that often prevent people from receiving care for mental health. Resources, on the other hand, can both directly improve well being while also making mental health more visible in the workplace. And finally, open communication removes stigma and normalizes mental health. So, altogether, they can reinforce each other to build psychological safety. The cost of silence. Silence can be expensive. Without supports, employees may experience lower comfort, higher stress, and more burnout. But with support, they can instead experience higher comfort, early help, and stronger retention. Employees who feel they cannot talk about their struggles are more likely to leave, miss work, or disengage. When companies build supportive environments, people stay longer, collaborate better, and show up as their whole selves. So, what can we do? These steps don't require massive budgets. Start with leadership. When managers talk about mental health, it signals permission. This can include checking in during one-on-one meetings or even mentioning the resources available during stand-up meetings. Next, make support easy to find and use. Organize workshops, mindfulness trainings, or even provide employee assistance programs. Then, ensure you have appropriate coverage for mental health care. Finally, measure culture. Ask employees if they feel safe to speak up. Data can provide progress just like any other business goal. The data back it up. Workplaces that talk about mental health and provide tangible support see greater comfort, openness, and trust. Employees are more comfortable sharing about their mental health, and this contributes to the kind of safe and supportive environment we know begets better well-being. In tech, where creativity and collaboration is everything, that kind of safety is priceless. Thank you for listening. We hope this encourages more organizations to make mental health support part of their core culture, not just an afterthought. Here are some additional references used in the slides.